The latest figures from Kenya indicate 4 more people have tested positive for the disease, among them 1 Kenyan and 3 foreigners from Burkina Faso, United States of America and Cameroon.
In the last 24 hours, a total of 69 samples from suspected cases of coronavirus have been analyzed in our various laboratories. Out of those, we have received confirmation that 4 people have tested positive for the disease. They include 1 Kenyan and 3 foreigners from America, Cameroon, and Burkina Faso. This now brings to 42 the number of those who have tested positive for the virus in Kenya.
Health Cabinet Secretary Mutahi Kagwe also revealed they are currently monitoring 1,426 close contacts of the infected persons, while 215 persons have been discharged after completing the 14-day mandatory quarantine period. At the same time, he revealed 2,050 persons are undergoing mass testing at several government facilities. Kagwe also took a swipe at a politician whom he accused of spreading false information on social media regarding the magnitude of the coronavirus situation in the country.
A leader in the country is claiming that there are over 7,000 people in mandatory quarantine. And while this may ultimately be the case, and even perhaps even more people might get into quarantine, it is simply, at the moment, not true. It sounds like a wish. Why would you wish that 7,000 Kenyans should be in quarantine? And why would you think that the government is not telling you the truth? To hide it for what purpose?
The number 7,000, which may have been misinterpreted to mean that 7,000 people were infected and or were being quarantined or held in isolation at Lenana. So I think that was the one issue in contention. And the second issue was a projection that by May we would be having 10,000 people. The infection is based on scientific research and scientific observations that have been made by people who are actually out there doing this, not only in Kenya, but all over the world. They have studied the graphs in countries that have been most affected, and given our situation, the projections clearly indicate that we may get down to 10,000.
On the question of preparedness, he pointed out they are building the capacity of counties to accommodate patients in the event the number of infected persons surges, as has been witnessed in other countries. Kagwe pointed out already Kenya has received 250 ventilators as a donation by the World Bank, and they are in the process of accumulating the available ventilators in the country.
The World Bank, for example, has donated 250 ventilators. That is in addition to everything else that we are buying. And what I can tell you is that every effort is being made to secure as many of them as possible.
Meanwhile, Industrialization Cabinet Secretary Betty Minor says talks are underway with motor vehicle companies to manufacture ventilators, as well as other local companies to assist in the manufacturing of protective gear as a way of building the country's capacity to contain the disease.
Our textile sector has confirmed that they have capacity to be able to make the PPEs, and we are in conversations also with our motor sector to see if they can also make some of these ventilators. They've not had to do it in the past, but they have that capacity. So we are confident, working also with our scientists and our engineers, that we can build greater capacity to be able to supply these goods within the country.
Kagwe appealed to Kenyans to continue observing good hygiene and urge employers to release employees in good time to beat the 7 p.m. curfew.
If you cannot release your employees on time, please prepare accommodation for them.
So far, the government says it has 1,000 ICU beds and is set to employ 1,000 health workers as the situation demands. Reporting for Channel 1 News, I'm Jackie Wambiru.